beauties, my name is Julia and that's my channel H.I. Beauty by Julia. The video today will be for pregnancy skincare, so let's answer a few questions. First, we're gonna look at the most common skincare concern during pregnancy. Then we're gonna look on the ingredients that we might be able to use during pregnancy and breastfeeding and the one that we should avoid. And the third part would be with regards to what treatments are safe during this previous state of our life. Before I continue with the video for today, I would like to advise you to discuss with your healthcare provider about any kind of concerns that you might have, any type of products and treatments that you are having at the moment or you're planning to have during your pregnancy and while you're breastfeeding. During pregnancy, a lot of things are happening in our body. So very often the concerns that we might have with regards to our skin might not be just about our face, but also about our body. So first we're gonna start with talking about body concerns. One of the most common skincare concerns during pregnancy are stretch marks. They are tiny tears that are happening in the supporting tissue underneath our skin when it is stretched close to its limit. There are a few things that are causing stretch marks. One of the reasons why stretch marks appear is genetic. So if your mother had them while she was pregnant with you, very likely is for you to have them once you get pregnant. Second thing is the rapid gain of weight. For some women, it really works great and they might be tiny while they're pregnant. With most of us, it really doesn't work that way, so you have to be careful what you're eating. Do not stop being healthy, but consider you are not eating for two people, you're just saying this. The last factor is the tone of your skin. For good or bad, if you have fair skin, it's much more likely to have stretch marks. In general, stretch marks do disappear, or at least they fade away once you give birth and when you start losing the weight that you've gained during. Once you're done with the breastfeeding and your hormones get back to normal, you can try with laser if there is still redness and the stretch marks are very prominent. Or personally myself, what I did with clients was combining microneedling, which means dermapen and dermaroller, whatever you prefer, with retinol treatments. And to be honest with you, it really worked very well. Varicose veins. I'm afraid that the reason for them, weight and genetics. My only advice is to continue to move. Walking is great and wearing compression socks might help as well. But during this period, nothing else. After you finish with breastfeeding, depending on the size of the veins, my suggestion is to make a consultation and you can try something like IPL or laser treatments. You can have something like sclerotherapy, or in the end, really the only thing is surgery. Eczema and dryness are very common. They happen because a huge part of the hydration goes to the baby, and when it's cold it gets even worse because in order for our body to adjust with the lower temperature, it shrinks the blood vessel and it affects the blood supply towards our skin. So the only thing you can do in these cases is really hydrate, hydrate, hydrate. Steroid creams might help. You do have to speak with your doctor about them. Rashes and itchiness are caused by dryness, but also from the sensitivity. During pregnancy, our immune system is very stressed because it is trying to keep the mom and the baby growing inside her safe. So it doesn't take really a lot of irritation in order for the body to react. Acne is a big concern and it might happen on the face, but it might happen on the body, especially on our back. Some women say that it gets much better during pregnancy. Some say that it gets much worse. If you never had acne, I'm afraid that during pregnancy, some of it might appear. Ideally, if acne is concern of yours before pregnancy, you should try to get it under control before you start trying to have a baby. In this case, when you're pregnant, it will be much easier to transition to different kind of products and supplements you might need. During pregnancy, the blood volume nearly doubles in the mother's body. So this healthy glowing might actually turn into heat waves and redness and rosacea, and it is very common. While pregnant, there are not many treatments that you can have for rosacea, but after you finish with breastfeeding, it's worth to start something like IPL. The last condition that I would like to talk about is melasma, or pigmentation, or pregnancy mask, or butterfly mask. In all cases, we are talking about the same thing. It happens on the forehead, on the cheeks, upper lip, and even the jawline. It is caused very often from combination of hormones and UV light, so it is very, very essential for every pregnant woman, no matter how strong is the sun, to use physical SPF every single day. Pregnancy mask usually disappears 6 to 9 months after we are done with breastfeeding. In some cases, it doesn't fade completely. So if this happens, there are many treatments and products that you might try. From things like crystal microdermabrasion to lasers to IPL to chemical peels and different kind of products with retinol, vitamin C or lactic acid. When you apply something on your skin, we simply don't know what part of those ingredients can go from the surface of the skin to the blood vessels and the bloodstream towards the placenta and from there towards the baby. While pregnant and breastfeeding, you should not use products based on vitamin A, which means retinol, retinoids, proacutan, and ingredients from this kind. Chemical peels are also in general considered for not being safe. The same is for laser and IPL treatments. I'm afraid that self-tanning is also out of the questions. Dihydroxyacetone, I'm sorry if I said it wrong, or DHA is the active ingredients inside self-tanning and spray tan products, and it is considered not to be safe for the baby. It is very sensible practice not to have dermal injections like hyaluronic acid for your wrinkles and your lips while you are pregnant or breastfeeding, and the same works for Botox injections as well. We simply don't know how this affects long term. Another very common ingredient is hydroquinone. This is one of the main ingredients in lightening products. So if you're doing something for pigmentation, you should check on the labels. And if this is part of your products, that you should stop using them for the moment. Aluminium chloride is another very common ingredient. It is part of the antiperspirants and it is very discussed if it is safe or if it's cancer causing, but just to be on the safe side, I will suggest to avoid using it. Although essential oils might help you with your aching back and swollen feet, a few of them might definitely be out of the questions, and they are thyme, clary sage, and juniper. Having a hot bath is not a great idea while you're pregnant. I am sorry to say, but the hot water definitely affects your skin. So it is better to use not so hot water, and for the face really a lukewarm temperature. Fragrances and strong perfumes also might cause irritation of the skin, so you should avoid them. Another thing to avoid are dry soaps, any kind of harsh exfoliating products that will cause irritation from a lot of scrubbing. Drying your skin during this period of time is not a great idea. Another ingredient is benzoyl peroxide. I'm sorry if I'm not saying this right. It is ingredient that is usually used to fight with pimples and acne, but it is not considered to be safe during pregnancy and breastfeeding. Not on last place, I would like to mention BHA or beta hydroxy acid, like salicylic acid especially, because a lot of people are saying that it is not safe to use it during pregnancy. Some studies are saying that as long as it is under 2% solution, it is safe to be used. So a lot of dermatologists are still prescribing it. But I think it's worth mentioning that you might have some kind of reaction and you might think twice about it.